Good morning to all. Today we'll be discussing on the pulmonary embolism. So let's see what is pulmonary embolism. Pulmonary embolism refers to the obstruction of the pulmonary artery or one of its branches by a thrombus that originates somewhere in the venous system or in the right side of the heart. Okay, so it is the obstruction of the pulmonary artery. So we all know the pulmonary artery is the artery that brings the impure blood from heart to back to the lungs, and then it will get purified by the lungs. Then again, with the help of the pulmonary veins, it will get transferred to the heart again. So the problem here lies in the pulmonary artery. When the pulmonary artery or one of its branches is blocked by a thrombus, that means a blood clot. When they are fused together, blood clots, they form a thrombus. So that thrombus is going to obstruct the flow of the circulatory flow. Then this thrombus will originate from where? It will originate from the venous system, okay, or from the right side of the heart. Okay, so this pulmonary embolism is an obstruction of the pulmonary arteries by a thrombus. Then in the pathophysiology, terms like embolism, impaired gas exchange, increased pulmonary vascular resistance will be there. So first, embolization. Embolization means a blockage of the air the circulatory passage by the thrombus. Then impaired gas exchange will be there. So impaired gases exchange means we all know that gases exchange between the heart and the lungs takes place where the oxygen release of carbon dioxide and taking in of oxygen takes place. So also there will be increased pulmonary vascular resistance. Pulmonary vascular resistance means the resistance against the blood from the pulmonary artery to the left atrium. Okay, so from the pulmonary artery, the blood will flow to the left atrium, right? So from the pulmonary in this passage from the pulmonary artery till the left ventricle, if there is any resistance, that means the blood flow will not be going smoothly. There will be resistance in the blood flow from the pulmonary artery to the left atrium. So there will be increased vascular resistance. Next term is increased airway resistance. So if there is a pulmonary resistance, vascular resistance, then automatically there will be airway resistance. That means the flow of air, there will be resistance in the flow of air through the respiratory tract. Okay, while we do inspiration and expiration, there will be resistance. They will not be occurring smoothly, the inspiration and expiration also. Then lastly, decreased pulmonary compliance will be there. That means the lungs' ability to stretch and expand will not be there. While we inhale and exhale, the lungs will expand, and the lungs will when we breathe in, the lungs will expand, right? Then while in exhalation also it will constrict. So the expanding and constriction of the lungs will not take place properly. In the next slide, as the pulmonary vascular resistance increases, okay, first I have told you what is pulmonary vascular resistance. It is a resistance against the blood flow from the pulmonary artery to the left atrium. So as this pulmonary vascular resistance increases, what will happen? The right ventricular wall tension will increase. So if the blood is not flowing out properly from the pulmonary artery to the left atrium, if the blood is not going, then the blood will accumulate inside the right ventricle. Then the right ventricle wall there will be tension in the right ventricular wall, and this will cause what? The right ventricular dilation and dysfunction. Dilation means it will be the size will be increased due to the pressure inside the right ventricle. Then when the right ventricle increases, the right ventricular wall tension will be increased, then also compresses the right carotid artery. Okay, it will compress the carotid artery also. Then what will happen? Increased subendocardial perfusion will take place. Okay, perfusion means the lack of oxygen blood supply. Okay, decreased blood supply will be there in the subendocardial, that means below the endocardium, beneath the endocardium. So endocardium, we know that is the layer of the heart. Okay, so there will be if there is a right ventricular wall tension, then it will automatically cause what? The subendocardial perfusion and limit the myocardial oxygen supply. That means the oxygen which is required by the heart to maintain the optimal function, it will be decreased. When this decreased, it will cause what? It will provoke the myocardial infarction. That means the person will be having the heart attack due to the blockage of blood flow to the heart muscles. Then eventually circulatory collapse may be there and death may occur. So these are all about the pathophysiology of the this one, pulmonary embolism. Predisposing factors, that means the causative causes or the risk factors. So in the causes and risk factors, what will be there? There is malignancy. Malignancy means the presence of cancerous cells inside the body or the respiratory system or the heart. Then the prolonged bed rest, then long haul and long air travel, obesity, then chronic obstructive pulmonary COPD, then chronic obstructive pulmonary disease, then the systemic arterial hypertension due to smoking and due to the taking of OCPs or oral contraceptive pills, then due to pregnancy, surgery, then postmenopausal hormone replacement, or thrombophilia. Thrombophilia means the abnormalities in the blood coagulation, or the atrial AF, that means atrial fibrillation, that means the irregular heartbeat. Okay, so these all are the predisposing factors or causative factors. Then in the hereditary factors, you see these are the hereditary factors which will be present at the birth. Okay, then like antithrombin 3 deficiency, protein C deficiency, protein S deficiency, factor 5 leading, then plasminogen abnormality, all these fibrinogen abnormality. So all these are the responsible, these are the coagulation factors which are responsible for the coagulation inside our body. Okay, so when there is deficiency of the coagulation factors, then what will happen? It will cause the abnormal coagulation inside the body that will again help in causing the thrombus inside the body. Okay, so these are the next is the clinical features. In the clinical features, there will be dyspnea, which may be continuous, mild, then pleuritic chest pain. This is a sudden sharp chest pain which is felt in our chest. Okay, while inhaling and exhaling, while we do the respiration. Okay, then substernal pain, substernal chest pain will be there at the below the sternum. Okay, then cough will be there, fever, hemoptysis, syncope will be there, sudden loss of consciousness, that means okay, then unilateral leg pain. Okay, leg pain will be there. Unilateral means from one side, in the one side only. Then signs of deep vein thrombosis. This is the leg pain is a sign of deep vein thrombosis. Okay, then diaphoresis, sweating, then tachycardia, tachypnea, increased heart rate, increased breathing rate, then hypoxemia will be there, that means low level of oxygen in the blood. Then S3 or S4 gallop, that means the cardiac murmur will be there. So these are the signs and symptoms. Next we will see the Wells score for pulmonary embolism. So this is a score which is known as a Wells score. Okay, So from looking at these 5 factors, we will determine whether the patient has how much risk the patient is having for the pulmonary embolism. Okay, when the patient has heart rate more than 100, if the patient has tachycardia, then the score will be given 1.5. Then if the patient is having hemoptysis again, then the score will be 1. Then if the patient is having the history of previous TE, that means the transesophageal endocardiography. Okay, so this is a diagnostic measure. This is a diagnostic test which is used, transesophageal endocardiography. Okay, transesophageal, that means from the esophagus. From the esophagus, the endoscopy will be inserted. Then with the help of the ultrasound, it will be used to review the heart chambers and the heart valves. Okay, so this is a diagnostic test. If the patient has a previous history of this test, that is the transesophageal endocardiography, then the point is 1.5 score. Then if the person has active malignancy, that means if the person is having the cancer, then 1 point. Then if the person has the signs of deep vein thrombosis, then the score is 3. So risk of pulmonary embolism, in the below we can see, if it is more than 6, then it is high risk. Then it is between if it is between 2 to 6, then moderate risk. Then if it is below 2, then it will be low risk. So for example, if a patient comes in the hospital, then when we take history, if the person is having hemoptysis, then the person has cancer, then the person has also deep vein thrombosis, then what will be the score? For hemoptysis, the score is 1. Then cancer means active malignancy is there, so that means score is 1. That means, and then the person also has deep vein thrombosis, which means the score given will be 3. So the risk score for that person will be 5. That means from 2 to 6, it is a moderate risk. Okay, so in the diagnostic findings, in the chest x-ray, we will see the Fleissner sign. That means enlarged pulmonary artery. This Fleissner signs, Hampton's Hum, Westmark signs, these are the radiological terms. Okay, no need to by heart, just we can just write the enlarged. There will be in the chest x-ray, what we will see, there will be enlarged pulmonary artery. Enlarged pulmonary artery will be seen. Then there will be a peripheral wedge of airspace opacity and implies lung infarction. They will just remember. In the next slide, we can see the Fleissner sign. Okay, that means the enlarged pulmonary artery. So when there is enlarged pulmonary artery in the chest x-ray, then we can confirm. Then in the Hampton's Hum, okay, there will be wedge shape opacity. That means a triangle shape opacity will be there in the will be seen in the chest x-ray. Okay, in the periphery of the lungs, that means at the outer corner of the lungs. It may be in the left side or in the right side. When we view the chest x-ray plate, then we can see a triangular shape opacity. Opacity means a light portion that can be seen in the chest x-ray. So we all have to remember that. Just remember that there will be enlarged pulmonary artery, then there will be a wedge shape opacity in the periphery of the lungs. Okay, so these are the diagnostic measures. Next is the management. In the management, will provide the oxygen by cannula, marks, ventilator. Okay, through the cannula or through the marks or through the ventilator, will provide the oxygen according to that. Then we will elevate the head end. When the person has dyspnea or respiratory problems, we should always elevate the head end. Okay, then when the person is having the deep vein thrombosis, then we should elevate the lower extremities again, so that blood flows from the from our legs towards our body. Then morphine to manage the pain and anxiety. Then injection heparin, this is a anticoagulant. Okay, then low molecular weight heparin. Okay, LMWH is low molecular weight heparin, can also be given subcutaneously. Then dopamine or dobutamine infusion to treat the hypotension and shock. Next slide, we can see the different low molecular weight heparin which are used, so we have to by heart all this. Then pulmonary embolectomy can also be done. Okay, so this is a surgery. Okay, pulmonary embolectomy, that means emboli which are blocking the blood circulation, these are removed with the help of the surgery. Then in the prevention, we can do like leg exercises, frequent position changes, ambulation, intermittent pneumatic leg compression device like anti-embolism stocking or compression stockings are there. We have to give to the patient, to the bedridden patient especially. Okay, so these are the prevention. So we have all know what is pulmonary embolism. That means it means obstruction of the pulmonary artery by a thrombus. Okay,